Okay, this video is why do most patients never get better? And in my experience, people love going for tests. They love it. In front of every Western hospital in the morning, there's like a river of fat, sick, and stupid patients going for their tests. They're going for their CAT scan, their colonoscopy, their cardiac calcium CT, lung cancer screening CT, MRI, ultrasound, nuclear medicine scan, mammography, the latest autoantibody tests, functional medicine workups, etc. And they're eager for this, and they sit there in the waiting room and you hear them having conversations talking about how beautiful the hospital is. These are the modern cathedrals of science, is the way these ignorant patients see them. And they talk about how impressive the technology is, the new CAT scan machine, the new MRI machine, etc. But they never ask what I would consider the basic question. What caused my disease? What causes my disease? What can I do to get better? That's the question. And here's the big news flash that patients don't understand, doctors don't understand, nurses don't understand. You don't cure a disease by taking a picture of it. If you take a picture, what the hell good is that? You take a picture when you need to take a picture, when you need to stage something, when you need to accurately, precisely diagnose something, okay? But most of the time, that's not the issue. Yeah, that can be wonderfully helpful. If you think you got an acute abdomen, right lower quadrant pain, you can get a CAT scan to confirm an appendicitis, go to the OR and be cured. That's a great thing. But that's rare. How often do I see an appy? Once a month at the most, okay? All right, what I'm trying to say is, all this workup and testing for the common diseases, diabetes, hypertension, coronary artery disease. Conventional medicine literally tells you these are chronic diseases, meaning that they never cure the patient. The rate is 0% cure. Why would you want to go to somebody who never cures your disease? They tell you before you even start, we will never ever cure your disease. Why would that be your first choice? It's like Virgil guiding Dante to the gates of hell, and above the sign on the gates of hell it says, abandon hope, all ye who enter. You will be taking pills the rest of your life, and you'll probably end up going for some sort of surgery one way or the other. Is that what you want? Okay, and the other thing is people always assume, I got to go for early diagnosis, all this cancer screening stuff. I gave a previous lecture about turtles, rabbits, and vultures with regard to cancer screening, but the point I'm saying is you're making a giant assumption. You're assuming that conventional medicine has a treatment, that they've got some type of treatment that makes you better off than you would be without it. That's a big assumption, and very often it's not true, okay? What removes cancer from your body? Your immune system, okay? What does chemo do? It wipes out your immune system, okay? Don't get me wrong, it sometimes is real helpful for some cancers, but it's not like you automatically want that. And how do you know you've got a rabbit and not a turtle? How do you know? A lot of times you don't. And you're going to get chemo for a turtle. You would have never known you had it your whole life. And now you're going to get chemo for a turtle and that might wipe you out? Is that what you want? Are you stupid? Okay, well, I see this every day, and it's not just, ignorant patients. This is things that nurses ask me and doctors ask me. They always want another test, and I say to them, how's your diet? They go, my diet's good. I go, well, what do you eat? And they're usually eating some version of the Mediterranean diet or something, and I'm like, the first question is, how do you improve blood flow to every organ? Improving blood flow is how you heal. You got to get good blood flow to the tissue. How do you optimize diet? How do you avoid vasoconstriction? How do you optimize function of the immune system? And that's then going to get you into questions. Is your sleep optimal? Is your exercise optimal? Is your sunshine exposure optimal? Are you doing everything to get your immune system to work? Okay, there's a whole bunch of questions here. Are your mitochondria functioning correctly? Are you currently being exposed to any mitochondrial inhibitors? It's routine that people are exposed to 10 of them at a time, 5 or 10 of them at a time. Why wouldn't you go through this? I got lectures on all this stuff. I got lectures on how to improve healing, how to heal anything better. Okay, so what I'm trying to say is, get your thinking correct. You heal things by fixing your diet, fixing your immune system, fixing your mitochondria. You don't heal anything with a picture. All right, and this happens all the time, every single day. So, and these are the people all going on a pilgrimage to Canterbury. It's a big fun adventure. There's the wife of Bath, the ex-wife of Bath. Anyways, hope you found it helpful.